Ladies and gentlemen, good morning, and thank you for joining us for another COVID-19 update. Let me acknowledge the presence of the Honorable Minister of Health, Wellness, and New Health Investment, Honorable Dr. Irvin McIntyre. Also with us this morning is the Minister of Tourism, International Transport, and Maritime Initiatives, Honorable Denise Charles. The Minister for National Security and Home Affairs, Honorable Rayburn Blackmore. And of course with us, the Attorney General, Honorable Levi Peter. I'm sure all of you have been anxiously awaiting another update on the COVID-19 situation in Dominica and any changes that may have occurred to the restrictions. Of course, we hope that today's briefing will clarify any concerns that you have, any questions that you've had over the past couple of weeks. Extensive discussions, of course, have been had and certain decisions have been taken. But before we get into the details of those decisions, first, an update on our statistics. The total number of confirmed COVID-19 cases in Dominica remains at 18. Total active cases, 0. So that means all of the cases have recovered. There have been no deaths in Dominica from COVID-19. The number of persons tested, 820. Number of negative results, 802. The number of contacts identified, 152. The number of contacts cleared, 152. The number of contacts under investigation at 0. And the number who are in government quarantine stands at 3. Our first presenter this morning is the Attorney General for Dominica, Honorable Levi Peter.
Can I say thank you very much for the introduction, and if I may just move into the presentation. As has been indicated, Dominica has been grappling with this pandemic, and so I say good morning to fellow Dominicans, residents, viewers, listeners here in Dominica, throughout the region and internationally. As you will all be aware, Dominica, along with other nations of the world, has, from the latter months of last year, that's 2019, been in the grip of the novel coronavirus, otherwise known as COVID-19. That pandemic has, since that time, dramatically changed the lifestyles across the world, including here in Dominica. The government of Dominica, having been closely monitoring the pandemic, recognized early on the potential danger to the citizens and residents of Dominica and began to prepare for and put in place appropriate systems, protocols, and practices necessary to protect the health and lives of citizens and residents here in Dominica. The government also recognized that some of the actions that would be necessary to protect the health and lives of residents and citizens of the country would have to be intrusive and would significantly adversely impact the populace. Indeed, by early March 2020, the government, health, security, and other authorities put together necessary legislative changes, health and other protocols, retrofitted existing facilities and constructed others, identified, prepared, and trained health and medical and support staff, and prepared the populace for the inevitable arrival of this dreaded virus on our shores. Thankfully, as a result of the early actions of the government and cooperation and collaboration of medical and health workers, police, security service officials, and others, Dominica has been able to very effectively manage the pandemic and minimize its infection and impact on our people. Speakers which follow me will detail the actions and achievements of the government in this regard. I should say the government and people of Dominica in this regard. As a result of the effective collaboration of the government and people of Dominica, and of course the adherence to, or general adherence to, the various legislative provisions that were imposed necessarily on the populace so as to protect the country and the nationals and residents from the effects of COVID-19. A number of pieces of legislation were enacted in Dominica, and in particular, you'll all be aware of the state of emergency that was declared by His Excellency the President. The effective management of COVID and the attitude and adherence of the populace has led to the position that the government is now able, on the recommendation of those advising in that regard, to bring the state of emergency to an end, or more accurately, to allow the state of emergency and curfew orders to come to an end. As you're aware, the state of emergency, which was declared by His Excellency the President of Dominica by proclamation in SRO 14 of 2020 on the 1st of April of 2020, which was subsequently extended by Parliament on the 6th of April, expired yesterday by effluxion of time. That's yesterday, the 30th of June, that SRO came to an end. Similarly, the Emergency Powers Curfew Order SRO 15 of 2020, which was also issued by His Excellency the President on the 1st of April, has also come to an end as of yesterday, the 30th of June. That is to say that as of today, Wednesday the 1st of July 2020, all of the restrictions and impositions introduced under the proclamation SRO 14 of 2020 and under the curfew order SRO 15 of 2020 will no longer be in force. That means that there is no longer a curfew in place. All places of worship, shops, stores, supermarkets, gyms, hair and beauty salons, barber shops, restaurants, and other business places, offices and activities are now free to open and to operate, and to do so freely, apart from the fact of having to recognize certain health-related regulations and protocols which will be in operation and will be detailed subsequently. I'm sure the Minister of Health will indicate some more in that regard. And those regulations and protocols will be finalized and formalized over the coming days. Before I close, I think I should say that it is important, very important in fact, that all citizens, residents and others realize that in spite of the fact that the state of emergency and the curfew order have not been reimposed or extended, that is not to say that we are free from concern as regards COVID-19. Indeed, the danger continues, and it behooves all of us as citizens and residents to adhere closely to all the protocols and all the guidance and any regulations that will be in place and we will be notified of in due course. I thank you.
And our thanks to the Attorney General, Honorable Levi Peter. Of course, no decisions are made in isolation by the Ministry of Health as far as the restrictions are concerned. We make those decisions with input from several sectors, including legal and, of course, national security. And the Minister for National Security and Home Affairs, Honorable Rayburn Blackmore, is our next presenter.
Thank you very much, Master of Ceremonies. I must commend you for the tremendous job you have been doing so far over the past few months. Let me first of all recognize in our presence the most distinguished Honorable Dr. Irvin McIntyre, I want to also recognize another colleague, a friend, the Honorable Minister for Tourism, Member of Parliament for Soufriere, Honorable Levi Peters, the Attorney General, most distinguished, members of the media fraternity, Dominicans listening in Dominica, abroad, our well-wishers, friends, and friends all. Let me just take this opportunity to commend the Dominican public for, in the main, complying to the protocols instructed and given thus far by the Ministry of Health. Let me just say further, I will speak mostly or specifically to the reopening of our borders, or the intended reopening of our borders. And let me just start by saying that the controlling and management of our borders are indeed critical elements to the management and containment of COVID-19. I say so because the origin of this monster destructive virus, the most destructive ever to hit mankind since 102 years of our civilization, is external. So this means, therefore, that this virus has to be imported. And that has been the mood of transmission of all the cases we have had thus far in this beautiful country. It has been so far a collective endeavor, and I want at this time to pause and to commend and recognize the effort of the police, the general manager of DASPA, equally the employees of DASPA, the custom officers who have not been spoken to very much, but who are doing a tremendous job in the front line, and the employees of the lead ministry, in particular the port health officers, who are also on the front line. Words of commendation cannot adequately express commendation and gratitude for what you have done thus far. I think we must put a day aside to celebrate the effort of our frontline workers in this country. It is important to note that COVID-19 started as a public health emergency of international concern and reach. It spanned a financial crisis, given the extended closure of ports and borders. And in Dominica's case, our borders have been closed for many months. That in itself has caused a tremendous dent on commerce and the revenue inflows of our country. I must say, given the unusual nature of this virus, where you have confusion amongst the scientific fraternity and the difficulty in isolating that virus and to come up with a vaccine in due time, there's obviously no perfect prescribed manner in the reopening of our borders / ports to normal operation. But ideally, it comes down to our tolerance and management of the associated risk. And what is the safest way to reopen our borders? Let me give the people of this beautiful country the assurance that your government will not compromise the health and safety of our people in any consideration to the reopening or for the reopening of our borders/spots. As you heard from the Attorney General who spoke just now, despite the fact that the curfew order died on the 30th day of June 2020, your government, with the leadership of our Prime Minister and the Minister for Health, has not taken the decision to immediately reopen our borders, but instead has put in place a well thought of time horizon with proper methods and protocols to reopen our borders. Let me just give you an insight as to what that time horizon that I just referenced actually is. July 15th, July 15th and August 7th. I'll give some qualification to that very soon in my very brief intervention. It's important to note that this time horizon can be changed based on circumstances surrounding the control and management of the spread of this deadly virus overseas. Let me say, once our borders are reopened, a well-coordinated process by the Ministry of National Security, the Ministry of Health, which is the lead ministry, the Ministry of Tourism, the Departments of Customs and DASPA, and all the relevant players will be applied. This process, as we'll hear from the Minister for Health, and you have heard before, quite eloquently from the Minister of Health and the Prime Minister, this process will include, but not limited to, conducting, and that's important, reliable testing instrument upon arrival. And also, quarantine, contact tracing when necessary, the increasing of testing, among other things. Let me just say that I'm aware, perfectly aware, that there are many malcontent among, quite rightly so, members of the populace, insofar as the number of Dominicans who are stranded overseas and want to be repatriated to the most beautiful country of their country, the beloved country, Dominica. And that priorities should be given to them. Let me just answer your question. The answer is yes. Priority will be given to our nationals who are stranded overseas and who want to return to the beautiful country once our ports are reopened. Let me, as I close, reiterate the dates intended for the purpose of emphasis. July 15th for nationals and August 7th for others, that is to say, non-nationals. And let me give you the assurance that strict measures will be put in place to ensure that our country remain safe for our people to continue to enjoy. In closing, notwithstanding the end of the curfew, the order, we are also contemplating the issuing of an order by the Minister for Home Affairs to mandate people to wear masks in public places. Because as we open our borders, notwithstanding all the systems we may put in place, we're also opening to the risk associated. So we have to ensure that the requisite protocols are maintained and also adhered to. May God bless this beautiful country. I thank you.
And our sincere thanks to the Honorable Minister of National Security and Home Affairs. Of course, he and his team, which includes the police force and the fire department, they've all been working tirelessly to ensure that all of our protocols are adhered to, and we want to thank them for their continued service. And like the Honorable Minister said, the dates tentatively for the reopening of our borders: July 15th for nationals, August 7th for non-nationals. Again, those dates, they're not etched in stone. We'll continue to monitor the global situation and make decisions accordingly. One of the sectors greatly impacted by COVID-19 is the tourism sector, not just for Dominica, but around the world. And we have with us the Honorable Minister of Tourism, International Transport and Maritime Initiatives, Honorable Denise Charles, to do a presentation.
Thank you. My fellow colleagues, Honorable Irvin McIntyre, Minister of Health, and Honorable Rayburn Blackmore, Minister of Security and Home Affairs. Fellow Dominicans here and abroad, listeners, friends, the media, good morning, and AG, good morning. After a successful period of containment and mitigation actions, Dominica has ended the state of emergency and eased all restrictions on the general population. Now, we start the journey of coexistence with COVID as we ease into opening the country for economic activity. As you've heard, it has been a very challenging time for business owners in the tourism industry and tour operators. The first step to opening up the tourism industry is to ensure that all the stakeholders are knowledgeable and comfortable with the protocols designed to make residents, locals, employees of the tourism sector and visitors to our shores safe and secure. We will start our reopening with staycations. This will meet two objectives. First, it will provide Dominicans with opportunities to patronize our world-class resorts and hotels once again. It will also enable our properties and other service providers of the industry to develop and to implement their plans to ensure that protocols are being adhered to. Currently, we are extremely excited to have over 10 properties express interest in participating in Staycation 2020 themed Experience Dominica. We also have 4 companies that are offering activities. Staycation 2020 properties will be offering attractive rates and packages. Folks who would typically travel to the US in the summer will have a lot to do and a strong alternative to Disney and Florida. We want to see as many people as possible patronize our local resorts and hotels. So you can and strongly recommend to your friends and families here and abroad. They will see many reasons to visit Dominica once we finally reopen to all visitors. So I'm going to list a few properties that are offering packages for Staycation 2020. Secret Bay, Sunset Bay Club, Tambourine Tree, Manikou River, SeaWorld Guest House, Fort Young Hotel, Atlantic View Resort, the Champs Hotel, Harmony Villa, Mango Island Lodges, Rosalie Bay Resort, Extreme Dominica, Rainforest Riding, Beno Tours, Shy Guy Tours, and Kempinski Resort and Spa. We encourage all Dominicans to go out over the next few weeks to rediscover our beautiful island and patronize the properties and service providers that will be open. As indicated earlier, Staycation 2020 will also enable our properties and activity providers to safely fine-tune their reopening protocols. For accommodation, specific protocols have been developed for management and supervision, general operations, guest arrival, front desk and lobby area, amenities like pool, gym, or spa, conference spaces, food and beverage, room service, public areas, housekeeping, employee staff area, signage, supplies. The Environmental Health Department and the Quality Assurance Unit at DDA are working with the DHTA and other property owners to develop the plans so they can be reviewed and approved. Once approved, the properties will be assessed and then certified. So you will only be able to open once you have been certified, after which all Dominicans can enjoy staycations. The current situation, re-COVID, is presenting challenges for all destinations, and Dominica is no exception. While the attributes of natural hiking trails and secluded beaches of the nature island is a perfect antidote to the COVID and stress brought about by lockdowns, like many other islands, the advent of reopening means the possible importation of new cases from visitors. The stellar work that the health professionals and citizens have done to contain and mitigate the spread of COVID could be wiped away and become a distant memory. Example, Antigua with the new recent rise in COVID cases. Dominica is contemplating several options for reopening, and one is to focus on the longer stay vacationer for several reasons. It allows a longer period for the health professionals to administer the series of tests, isolation, quarantine, and surveillance needed to satisfy themselves that visitors are not infected, therefore allowing Dominica to continue to advertise itself as a safe health destination. 2, there is a high incidence of repeat visitation by Dominican nationals living abroad. Diaspora are a more accessible segment, allowing for critical foreign exchange and direct economic transactions to communities during this longer stay. Lastly, cater to visitors that want to take an extended break away from their situation. So Dominica will be seen as a place to be away from home, so one can work away from home. Offered, as I said, as a safe haven to retreat and to spend summer holidays. Parents can work utilizing Dominica's advanced IT and Wi-Fi functionality while their kids explore the wilderness in a safe environment. Cater to a regional traveler that is looking for a longer vacation but is coming to a safer environment. A communication plan to create the right message to the segments can be put in place. It will require support of the private sector. If you need a copy of the protocols, please contact EHD or DDA at 255-8221 or send an email at tourism@dominica.dm. The protocols will soon be posted on our website. Let us continue to remain safe. Thank you.
And thank you to the Honorable Minister of Tourism, International Transport and Maritime Initiatives, Honorable Denise Charles. Of course, with the opening of our borders, all those who intend to come into Dominica will be subject to certain protocols that we hope that you will be very willing to adhere to. And our next presenter, the Honorable Minister of Health, Wellness and New Health Investment, will undoubtedly highlight some of those protocols. And I welcome Dr. Irvin McIntyre to address us.
Before I begin, let me first recognize the Minister for National Security and Home Affairs, Honorable Raymond Blackmore, Minister of Tourism, International Transport and Maritime Initiatives, Honorable Denise Charles, the Attorney General, Honorable Levi Peter. Pleasant good morning to the listening public, both here, at home, and abroad. It is again my pleasure to brief you on the ongoing COVID-19 pandemic and restrictive measures which have been in place. It has been 84 days since the last confirmed case of COVID-19. We have completed community-based screening throughout the island using rapid antibody tests, and there is no indication of ongoing community transmission of COVID-19. In spite of the fact that there is no evidence of local transmission, testing of our local population is to continue. Thus far, we have tested over 800 individuals using the PCR method. The test positivity rate of 2.2%, meaning approximately 98 out of the 100 people who were tested for COVID-19 in Dominica did not have the infection. This rate is among the lowest in the OECS countries. Our surveillance data on influenza-like illnesses has been very low since March 30th, 2020. This year, we have observed a sharp decline. On average, 4 cases per week, as compared to 25 cases per week in 2019 for the same period. This is most likely as a result of public health and social measures, that is, physical distancing, hand washing, face mask wearing, which have been implemented. This underlines the fact that public health and social measures does play an integral part in preventing the transmission and spread of infection. For this reason, we are pleading to you, the public, to continue to adhere to all the guidelines, measures, and protocols put in place by the Ministry of Health. Today, 1st July, marks the expiration of the emergency orders. Obviously, this brings to an end the restrictive measures of curfew, as well as opening of local businesses and mass gatherings. However, the public health and social measures we have been advocating for over the past few months must continue. This is even more relevant and necessary in view of our intention to reopen our borders in the latter part of July. As a matter of fact, a tentative date of 15th July has been set for nationals and residents, and 7th of August for non-nationals. We have put a series of protocols in place for this. For instance, there is the pre-arrival screening questionnaire, which must be filled out at least 24 hours before arrival in Dominica. This can be done online, and if not so, it will be done at a kiosk at the ports of entry. Apart from that, there must be a PCR test done from an accredited lab 24 to 72 hours prior to arrival in Dominica. On arrival, there will also be thermal screening, that's a temperature check. There will also be rapid antibody testing, and based on the rapid antibody testing, there can be a secondary screening site where we can actually do PCR swabbing as well. Following all of these measures, we have the different levels of quarantine, which could be self-quarantine, it could be government facility quarantine, or it could be hotels or guest houses which have been certified by the Ministry of Health. Presently, we continue to fine-tune these protocols for reopening of the borders. We all know there is no blueprint as to how borders are opened. It is a new experience for all governments, and it is uncharted territory. We are adopting a pragmatic approach to suit our specific circumstance, while we learn from the mistakes of others and also benefit from the best practices of others as well. Our overall objective is that of risk minimization, considering the possibility of importing the virus when borders are opened, preventing economic collapse, and recognizing the hardships of Dominicans wanting to return home. Stakeholders need stable, realistic protocols which reflects our understanding of capabilities and capacity as regards to detection, containment, and management. We have engaged all stakeholders in our preparations. Training has already been conducted to include hoteliers, guest houses, taxi drivers, Dominica Air and Seaport Authority, immigration, customs, among others. This training was done with the assistance from PAHO, and we have developed protocols which include pre-arrival screening, on arrival screening and testing, and also surveillance and quarantine guidelines. Specific dates for reopening will be made available to the public. As I've mentioned before, we have then set 15th of July for nationals and residents, 7th of August for non-nationals. And as I mentioned earlier, we have not had any confirmed case of COVID-19 for the past 84 days. We have no active cases presently, neither do we have any suspect cases, and there are only 3 persons in quarantine. In view of these facts, as of today, Wednesday, 1st of July, all curfew restrictions are lifted. Physical distancing will now be 3 feet. Sporting activities are allowed to resume, allowing for spectators. Daycare centers, which have been closed, are now allowed to reopen. Public and entertainment events, as well as churches and places of worship, are allowed a maximum of 250 persons. Further consideration will be given to larger events in the future. Hospital and nursing home visits are limited to 1 person at any one time. However, physical distancing, hand hygiene, and wearing of masks must continue. This also refers to all businesses which were previously allowed to open, as well as churches. The protocols that we have developed and made available to all businesses must be adhered to. These same protocols were responsible for flattening our curve and stopping community transmission. Following these protocols has brought us where we are today. This is no active cases and no suspect cases, and only 3 persons in quarantine. Having said this, we in the Ministry of Health are thanking you, the public, for your cooperation and compliance so far in fighting this COVID-19 pandemic. But we are again pleading to you, the public, to remain focused, be diligent, and do not become complacent. We must not let down our guard, because that's the only way we can ensure our safety and the best outcome possible as regards to COVID-19. We in the Ministry of Health continue our surveillance activities, and our health promotion team, as usual, is doing their best to keep us informed and updated. The Ministry of Health is also fully engaged in making sure we have adequate amount of testing supplies and other medical supplies, such as masks and PPEs. We are also in constant conversation with our friendly governments, such as the People's Republic of China, the Bolivarian Republic of Venezuela, and the Republic of Cuba, regarding assistance with supplies and medical personnel. They have always demonstrated that a friend in need is a friend indeed. And for this, we are very grateful. We also thank PAHO for their continued technical support and supplies. Their most recent donation was a brand new vehicle to assist us in our community surveillance activities. Let me again thank all the frontline workers for a job well done. The country applauds you and appreciates your effort in keeping us all safe. My final words to all of us is to continue physical distancing, continue hand hygiene, continue wearing masks, and continue sanitizing and disinfecting our homes and places of work. I thank you, God bless you, and may God bless Dominica.
Thank you very much to the Minister for Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre. On behalf of the Government of Dominica and especially the Ministry of Health, I'd like to commend the general public for your patience and your cooperation thus far in this united front that we have built against COVID-19. Now, the fact that the state of emergency has been lifted to include the curfew and the fact that we are about to reopen our borders again does not mean that we have to become lax or callous even in our behavior. Let's continue to heed all of the recommendations from the experts. I would like to thank the Office of the Prime Minister for accommodating us once again, including the technical team for facilitating our briefings thus far. And ladies and gentlemen, I'd like to thank you for your attention. Have a good day.